location in Beverly Hills, California with Dr. Aaron Rollins. Dr. Rollins, welcome.
Hi, thanks for interviewing me.
Dr. Rollins, you've got a fabulous facility here. Tell us about where it's located.
Thank you. We're in Beverly Hills on the corner of Wilshire and Weatherly.
Awesome. Dr. Rollins, we've been discussing Tickle Lipo. Perhaps you can tell us a little bit more about the technical side of Tickle Lipo and why it makes such a difference.
Sure, I'd love to. First of all, the nutational movement is extremely important because not only does it go back and forth like some other systems, but this motion, this rotary motion, I think it just makes all the difference. It used to be that I had to pinch the patient to get the fat out with systems that move reciprocating kind of back like a jackhammer. But now I don't have to do that. I don't have to pinch the fat to get it to come out. All I have to do is move the tickle system wherever I want the fat out, and it's just like airbrushing the patient. I don't have to pinch him. It does the work for me. I kind of feel like it's like using a sewing machine instead of sewing something by hand. So you get a smoother result, and it's more technically, it facilitates the aesthetic result.
Is there anything else, any other features about the Tickle Lipo system that you like?
I think it's really important to discuss fat harvesting. Whenever you're using a power system, I think the physician fears, geez, all this movement and all this mechanical action under the skin might destroy the fat cells. And when I used, for example, the micro-air system, I noticed fat viability was very poor. When I switched to the tickle system, I started using something called the Super G cannula for fat harvesting, and it's just been incredible. Not only is the fat extremely viable, but it doesn't take forever to harvest either. So I can get a lot of good quality fat easily for my Brazilian butt lifts, for fat transfers to other areas. It just makes it so much easier, and my patients are happier because more of the fat is viable.
What other, you mentioned the Brazilian butt lift earlier, what other kinds of procedures are you doing with your tickle system?
I do a lot of revision surgery for other doctors. I think in the early 90s, 80s, even the early part of the 2000s, a lot of doctors with traditional lipo were taking out too much fat in some areas, leaving divots, holes, things like that. I see a lot of these patients, and I remove fat from one area, and then I transfer it to the area that has a divot or whatever the concern is, whatever the problem area is.
The technology has come a long way, hasn't it?
Oh, it's just incredible. There's no comparison between Tickle Lipo and a manual technique. It's prehistoric now.
This is William Brouillet on location in Beverly Hills, California with Dr. Aaron Rollins.